Hey everyone, how's it going today? Nurse Mary back, and for those of you who don't know me, I was a cardiac ICU nurse in the city, New York City, for 13 years, and I left the bedside care to holistically help people heal. I have a family history of both my parents dying of heart attacks and my brother, and that was before I became a cardiac nurse. And while I was a cardiac nurse, I realized that I wasn't learning the things I needed to do to prevent the cardiac disease. So in the hospital, you're dealing with a sick care system. With doctors, you're dealing with a sick care system. It's not prevention. It's not teaching you how to avoid this problem. And the problem is when you have had a cardiac event and you go into the hospital for treatment, that's great. I mean, yes, I'm not saying that we don't need acute interventions sometimes in the event of a heart attack. But after that, there's this huge gap and there's no care. You are just left to go out in the wild on your own and whatever you can do, but then just come back in for your next doctor appointment and your lifelong prescription refill. That's not health and wellness. And we need to get you back to homeostasis, back to where you were as a healthy human being. Heart disease does not start in the heart. It's downstream from all these other things happening over the years, all these toxins, all the stressors, and it's not your fault necessarily. And the thing I'm imparting is that you do have the power to make a turnaround there. And this week, what we're talking about is the incidences of heart attacks after daylight savings change. And that is because our circadian rhythm is off. The way that we are supposed to be getting up with our alarms has now changed, and it's forcing our body into a new schedule that we're not ready for. We as humans are not designed for this kind of life. We're living in an environment with fluorescent lights, LEDs, cell phones, computers, all that. We're not meant to live like that, and we're trying our best to adapt, and that's another source of stressors causing heart attacks. But what we're focusing on this week are 4 pillars, and the one I want to focus on today, we focused on circulation yesterday, we'll focus on blood pressure today. And what we want to do is make sure we have good circulation and low blood pressure as some of the interventions to prevent a cardiac event. So Mary, how do we lower our blood pressure? You guys have the best questions. So how do we do that? We increase nitric oxide. Mary, what is nitric oxide? Nitric oxide is a molecule inside our vasculature that helps to vasodilate, to dilate those arteries. You dilate the arteries, you bring the pressure down. You open up a hose, you bring the pressure down. You tighten a hose and it backs up where? If you kink a hose, it backs up to the spigot. Which is your heart in this case, in this example. So you want to keep your blood pressure low. I'm going to give you a tip of the day here. Stop using mouthwash. Mary, I want good oral care. Oral care is linked to cardiac health. Yes, that's true. But when you use mouthwash, you are killing the bacteria that convert nitrates into nitrites that vasodilate and increase your nitric oxide in your body. So no more mouthwash. It kills those enzymes that convert those leafy greens and beets into nitric oxide. Okay, that's your big tip of the day. For those of you that live in the northwest corner of Connecticut and near that area on the New York side, upstate New York, I'm giving a retreat on March 21st, and you can find that on my Instagram. And you can also find information about it on my website under retreats. It's going to be really special, and I will be going into stress mitigation, and how we regulate our nervous system. You can't do anything if your nervous system is dysregulated, and the problem is we are trying to do our lives when we're in fight and flight mode. So we'll be talking a little bit about that tomorrow, and I'll be doing a big presentation at this retreat. And then keep your peepers on my website, because under workshops, I will be doing a workshop on that as well. So lots to think about. If you would like to work with me one-on-one, go to speakwithmary.com to book time on my calendar. Again, That's speakwithmary.com. Take a look at my website, and if you align with what I say in there, then you need to come and work with me, because we will get you turned around. All right, have a great day, everyone.